And so next I'd like to introduce Dr. Alice Lorch. She's Assistant Professor of Ophthalmology and Residency Program Chair. As a Residency Program Chair, she was instrumental in adapting the program for these unprecedented times. She will highlight the key academic innovations, as well as lasting changes in the way that we train fellows, residents, and other trainees.
Thanks for the opportunity to speak. I'm going to talk about some of the challenges that we've faced and also some of the successes that we've had over the past couple of months, specifically in education. Before I do that, I want to acknowledge the entire team. I want to particularly point out Dr. Grayson Armstrong, who's our Chief Resident, and Dr. Aisha Trace, who's our new Associate Residency Director, because both of them in particular have really been working tirelessly with the team over the last couple of months to make this a successful program. So our program was pushed into action very early in the pandemic because we had cases of COVID-19 at our hospital. So we declared emergency pandemic status with the ACGME, and this allowed us to modify our training schedule to meet the situation. Our goals in doing this were, above all, to protect our residents, but also, as Dr. Gardner mentioned, to make sure that we had appropriate ophthalmic coverage for all of our sites. We split our residents into 2 teams, and they covered emergency rooms and inpatient consults across all of our hospitals, but they were pretty much pulled from all of their responsibilities. I would say our residents rose quickly to the challenge of COVID, and they really went above and beyond. So many of them volunteered to cover the post-acute COVID floor that was created at Mass Eye Near that you heard about, and others staffed hotlines to triage patients and determine whether they actually needed to come in for care. So like everywhere, and as you've heard, surgical volume at Mass Eye Near was dramatically reduced starting in March. So we continued as a hospital to do urgent cases, and our residents were still involved in these. However, over the last 3 months of the year, residents together only logged 100 primary cases. So this is over a little more than 1 per resident per month, which is a dramatic reduction from what they're normally doing. In addition to having limited opportunities in the OR, we were also left without the opportunity or the ability to simulate surgery for our residents. So as you can see, we have an incredible wet lab, but we had to cancel all of our group wet lab sessions, and we even had to close down our IC simulator for a period of time because there was so much concern about the ability to appropriately decontaminate and keep everyone safe. And just really now we are starting to cautiously open up and do small group teaching sessions again in our wet lab as we prepare for the reopening of the ORs. So because of these limitations, we really tried to get creative. So through much hard work by many of our residents and our chief resident, we built this virtual surgical training lab curriculum. And this combined online learning materials and a weekly live case conference. And this is something that has been shared nationally by the AUPO, and we know is being used in many programs across the country, and it's something that we've been particularly proud of and hope to keep using as we move forward. Similarly, we spearheaded a Boston-wide didactic curriculum, and this was composed of multiple different lectures from different institutions each day. And in addition to providing virtual education for our residents, we also hosted a virtual medical student rotation through HMS. This was led by Encore Shaw. So in addition to the changes that we're seeing in our residency, there are going to be significant changes to our recruitment to the Mass Eye Near family this year. So per the ACGME recommendations, our residency and fellowship recruitment and interview processes will all be entirely virtual. Personally, I think there are significant advantages to this. So programs are going to be forced to provide more transparency to all applicants, give more information about what our programs are like. And we are already starting to think about how we can do this with social media and webinars and other ways to really promote and share ourselves. In addition, this really saves a lot of time and money for medical students as they go into residency, which is another benefit to this change. I can't talk about recruitment without mentioning this is an exciting year because it's the first year we are going to be recruiting for a 4-year program. So as Dr. Miller mentioned, we have formed an integrated internship with Newton Wellesley Hospital. And starting in July of 2021, all of our residents are going to do their internship together there. And then they will spend 3 months of that year with us in ophthalmology, which is a really exciting change to the program that we're looking forward to. So I'd say overall, the last few months have clearly brought a lot of tragedy. However, I do think there are positives that have come out of this in ophthalmology education. Some of this is the move to the virtual platforms that we've discussed. In addition, we have dramatically changed the program structure for this coming year, so our rotations are going to be limited in length, and this is really to protect against educational gaps. We've been jolted into what we call our new normal, and as a result, we're really going to start thinking critically about measuring competencies of individual residents instead of just relying on an apprenticeship model that we've been so comfortable in for so long. And I think those are some of the things that we have to look forward to. I want to conclude with just a brief thank you to our trainees. So as you've heard, they've all really remained dedicated to our patients and also each other during this very difficult time. And we are particularly proud to welcome the graduating seniors into our Mass Eye Alumni family. So thank you.